Welcome everyone. Today we are going to discuss an important clinical lesion, that is medullary carcinoma of thyroid. We are going to capture all high yield points. So please stay tuned till the end of the video. Medullary carcinoma of thyroid is a neuroendocrine neoplasm. It is derived from C cells, the parafollicular C cells. They secrete calcitonin, serotonin, ACTH, vasoactive intestinal peptide. So we are going to see lots of hormonal substances being elaborated in the bloodstream, and they are many a times as a part of MEN 2A syndrome and 2B syndrome, and sometimes they also arise sporadically. Majority of the cases do arise sporadically, and few of the cases they arise as a part of MEN 2A and 2B syndrome. There is a red proto-oncogene mutation. This is quite important to remember. Red proto-oncogene mutation that play a role in medullary carcinoma. There is a mass in the neck, dysphagia, hoarseness, diarrhea due to secretion and elaboration of various hormones or neurohumoral mediators like vasoactive intestinal peptide, ACTH. They cause diarrhea and even Cushing syndrome. Hypocalcemia may be seen, but it's not a prominent feature. Hypocalcemia can be seen due to calcitonin elaboration. Microscopically consists of nest, trabeculae, and even follicles of cells. Cells could be of varying shape, like it could be polygonal, plasmacytoid, spindle-shaped cells. So these are important things feature in the vignettes. Polygonal, plasmacytoid, spindle-shaped cells. So the cells vary a lot. Amyloid derived from calcitonin is seen, and immunohistochemistry is positive for calcitonin, CEA, and thyroglobulin. Electron microscopy will show neuroendocrine electron dense granules will be seen. And here you can see the mediator, the image showing this hyalinization like feature, eosinophilic substance deposit, and this dense amorphous eosinophilic substance is nothing but amyloid, which can be elaborated by Congo red or doing specific immunostain against calcitonin. So how do we cure? The treatment is total thyroidectomy, especially in familial cases. A total thyroidectomy has to be done, with cervical lymphadenectomy could be done for node positive patients. So thank you for the patient hearing. Do watch, like, share, and subscribe to the channel. Thank you.